we're doing here is that we're actually kind of measuring what happens when a muscle goes wrong. So we're not essentially looking into the muscle, but looking into the output of the muscle, looking into the movement of what actually happens when you have got muscle damage. And this is particularly seen in people that are suffering from the so-called whiplash disorder, which is a kind of an umbrella term for many things that can be wrong. It can be ligament, cartilage, muscle. But what they do have in common is that they have got these kinematic deficiencies and a disrupt kinematic chain. And we're looking into how we can focus on the deep stabilizing muscles, the deep neck flexors and the deep neck extensors, to activate them, which in many cases they become inactive, and the movement occurs in the kind of the big superficial muscle, causing the shoulder pain, causing the headache, etc. So this is what we have come up with here, which is an IMU, measuring acceleration and gyro, and using an algorithm to convert them into 3D Euler angles. We transmit the data via Bluetooth to a PC now on a web-based browser, and see if this works. Yeah. So what we're testing are indeed three things. We're testing proprioception and the spatial awareness, and we're testing the movement control, which is what I'm doing there. So it's called the butterfly test. So the aim of the test is to follow the red target, whereas you are controlling the green cursor, just using the data that is collected by the sensor on the head. So what we're measuring here are variables such as kind of how far are you away from the target, how much time in percentages you spend on the target, how much time are you in front of it, or etc. So, and also we're looking into the smoothness of the movement. So is this a smooth movement, or are you jerking your head in order to keep up with the target? And as you can see, the velocity of the target is variable. So it depends on the radius of curvature. So it essentially means that it goes faster on straight segments and slows down during bend. So, and this is according to Fitts law, which represents the human kinematics. So you trace this trajectory. So we've got three sets of trajectories. So we've got an easy set or a medium set and a difficult. And we assess these following variables for each set. So we had three groups in our study. We got a control group, we got a concussion group, and a whiplash group. Carried out these 4 kinematic tests in conjunction with questionnaires as well about how they were feeling. And there you can see the demographics of these of the groups. So here's the measurement setup. We used these straps just to be absolutely sure that there was no torso movement, because that's obviously going to influence the results. So so the people were strapped in. So here you can see all of the measurements all superimposed upon each other. So the top one is the control group, the asymptomatics, and the green represents the easy curve, the blue is the medium, and the red's the difficult. And then you've got the concussion group, and then you've got the whiplash group. And then you can see, just looking at the trajectories, that between the asymptomatic and the whiplash, then they kind of tend to go a little bit all over the place, indicating poor postural control or muscle control. Now, going a little bit into these variables that I spoke about earlier. So this variable here called amplitude accuracy, which is the average distance between the target and the cursor. So the lower this number is, the better, because as you can see here from the 3 curves, then we do have a statistically significant difference between the healthy and the whiplash group. The concussion group is somewhat ambiguous. There are individuals there that have no proper, no maybe musculoskeletal. It's more of a traumatic brain injury. But as a screening tool, that would be a good thing for the clinician to know the type of injury. Time on target, how much time do you spend on the target? So again, there's a significant difference between the control and the whiplash group. And here you can see a graph showing the proprioception. So this is called the head neck relocation. And what we're doing here is that we are placing the sensor on and rotate to all directions, and we are asking the subject to go back to the initial position. So we start in a neutral position, rotate fully, and then go back to the initial, ask the subject to find again the initial position. And we're essentially looking at the difference between the initial and the final. So the results from this were inconclusive. There is not a statistically significant difference between the groups for those movements. But looking at the velocity as well, kind of how quickly do you carry out the movements, then you can see that there is a clear difference between the groups. So looking into kind of, how secure you are in rotating your head as well can be an indicator. Range of motion, that's just your standard range of motion, basically how far can you bend your neck in all planes here. And again, there is a difference, significant statistical difference. Now, this session is obviously about artificial intelligence and machine learning, etc. So, even though we're not quite there yet, but that's where we're heading, for each of these tests, we do have a significant number of variables in conjunction also with the questionnaires about how the people are feeling actually. Taking these data and throwing that into the funnel, into the number cruncher, to give us a classification, this triage of categorizing the subjects, the patients. And in the future, where we want to be is to be able to design an exercise tool which is a part of this software as well, to get the patients to take this home and do the exercises, do the training, because all the research says that, you know, if you move a damaged, an injured joint, that is beneficial. So, but then finally, so I've just been showing you kind of a cross-section of all the tests, but what about on an individual level? So how can we, because a person can be good in one test and bad in another. So getting a kind of a holistic view over all the tests for each individual, again, can give the clinician ideas about where the deficiencies are. And also to normalize it, because each variable does have a probability distribution. So we can normalize, so if the circle represents the best possible result, and the longer the arrow, the better you perform on that particular test. So to conclude, so we saw a significant difference measuring the kinematics between these groups for many variables. And also the idea is that to give the clinicians the tool to make the rehabilitation of these injured patients, these musculoskeletal injuries, more effective, and to be able to target this. And then give the patients these devices to go home, because then you can just log on through this through your web browser, do the exercises, and the clinician can check A, if you're doing it, and B, how you're getting on, and then can adjust the intensity or the difficulty of the exercises accordingly, how they're doing. And also it's beneficial for the patients, because he'll get a target. This is where I need to be, and so something to aim for. So, and also, so this here kind of gives a holistic overview of the quantity and the quality of the head movements, about the neuromuscular joint control of the patients. Okay, so yeah, I think I'm on time.
So we have time for a question. Yep.
So, congrats. I think it's a great tool. From my perspective as a physiotherapist, I would love to work with this device.
Perfect.
And I see I see many challenges and chances in creating a very concrete rehabilitation program.
Mm-hmm.
May I ask, how long after whiplash did you include your group that you tested,
Mm-hmm.
and how long after concussion were they patients?
Yes. The whiplash group here, that the inclusion criteria was that you had a rear end collision,
Yeah,
and that was longer than, the neck pain was for longer than 3 months.
longer than 3. Oh, okay.
So,
already chronic ones. Mhm.
So yeah, so but having said that though, with the demographics, then as you say, beggars can't be choosy, and the patients were at various stages of their. Some had gone to a physiotherapist, some not, and some were maybe more long term, etc. So in the kind of when we iterate this, then to try to catch the patients at a specific time point post injury.
Okay, it would be nice to follow up then, because it could be also a follow-up tool now to compare.
No, absolutely. Maybe just one comment on that, because what we've done is that we've taken in the clinic that we are collaborating with, we've taken 40 of those and taken a pre-measurement before the rehab, and then a post-measurement after, and we're seeing then that they are improving on their neuromuscular control.
Yeah.
Yeah.
And you could also enlarge the group of participants, because every spinal cord patient has also whiplash, and especially the tetraplegics. They are well known for this. And so
Absolutely. Yeah, okay.
I would
Thank you.
encourage you to include also this group.
Fantastic. Will do. Measure compliance, yeah, absolutely. Because that we all that have been to a physiotherapist, we sometimes do our exercises, sometimes not. And obviously the recovery doesn't happen in that 30 minutes per week that you have.